Okay, welcome everybody to our session today. My name is Hannah again, and today we're going to be talking about Alzheimer's disease. We're going to be talking about some early signs and symptoms to be aware of, how diagnosis happens, and what are some new potential treatments out there. All right, so what is Alzheimer's disease? This is the most common type of dementia that is diagnosed. It is a type of dementia that is progressive. It affects memory, thinking, and behavior. And what's happening is that there's some brain changes and cell death, tissue loss in our brain, and that is causing these symptoms to occur. A common early symptom that we see is difficulty learning new information, as well as memory becomes impacted. So we start having some lapses in memory of things that were once easy for us. Over time, these symptoms can start to affect our ability to participate in meaningful activities and live safely and independently. So what is Alzheimer's versus dementia? We're going to break that down. Dementia, this is an umbrella term. It's a general term looking at the symptoms of decline in memory, thinking, reasoning, whereas Alzheimer's, this is a very specific brain disease that accounts for 60 to 80% of dementia cases. So just to summarize again, dementia, this is a general term, Alzheimer's, a specific form of dementia. So a little bit about the brain and our anatomy. The brain is made up of 3 different parts and it weighs about 3 pounds on average. The picture to our left, the cerebrum, that is the majority of the bulk of our brain. Then we have our cerebellum and our brain stem. And we're going to kind of talk about what role Alzheimer's plays and how it shapes and changes our brain over time. So what happens is that Alzheimer's disease leads to, again, that tissue loss and that nerve cell death. So what we see on the very left-hand side, a brain without the disease. That's our 3 parts, about 3 pounds, no shrinkage happening. Then we go to the middle picture. This is a brain that has now advanced Alzheimer's. And there's a lot of shrinkage happening where we do see that tissue loss and nerve cell death. To compare the two on the right-hand side, now we have a little shaded picture of our brain in the background to show you how much has actually shrunk from the normal typical size. So a lot can happen because of that Alzheimer's. And we're going to talk about what this looks like under a microscope and what's really going on. At this point, there is not a known cause for why cell death and the tissue loss is happening in a brain with Alzheimer's disease. What we're finding is that there's 2 different suspects. 1 being plaque buildup and 2 being tangles in the brain. So 1, our plaque buildup. This is abnormal clusters of protein that is found in our brain. And then on the right-hand side, we have tangles. These are twisted strands of protein in dying nerve cells. So when we look at a scan of our brain, what we're finding is in someone with Alzheimer's disease, plaque buildup and these tangles, which are disrupting the messages being sent from our brain to the rest of our body. So what happens then with the progression and how it changes throughout the brain over the course of the disease, we have this plaque and these tangles, which typically start to spread in a pattern through the brain. So in early diagnosis, we're seeing a small area where this is impacted, and that's affecting our learning, our ability to plan, have reasoning, and just memory overall. In the mild to moderate stages of Alzheimer's disease, now speech is becoming impacted. In our severe, we're now seeing multiple lobes of our brain being impacted. So now we're seeing a loss of communication and difficulty recognizing others. So that's kind of how it progresses over time. Some risk factors to keep in mind and to be aware of. Again, there's not a direct cause for why Alzheimer's is diagnosed. These are all examples of just things that have come up and are correlated to the diagnosis. Number 1, and the primary risk factor is just overall aging. As we age, our brain kind of starts to change shape. And we're going to talk about some different things we can do to help prolong that change in our brain. Exercise is a big one. 2, family history, so genetics do play a part. It is a small part, but it is still a part. 3, gene mutation. So some people, for some reason, just have an increased chance of having some mutations of our genes and having an increased risk of developing that plaque and those tangles in our brain over time. Not sure why, just kind of something that we have, some biomarkers. 4, Cardiovascular disease, if this is something that has impacted you for a long period of time, you have an increased risk of developing Alzheimer's disease later in life. Low education level, and what I mean by that is just someone who has not been able to take care of themselves and have a full understanding of what's going on with their themselves internally. So that may impact the potential of going to see a doctor because they're not aware of what's happening. That's just an idea. Sedentary lifestyle, one, and then diabetes and smoking. So these again are just potential risk factors that may increase the likelihood of developing Alzheimer's disease. So what this looks like in the United States is, again, the most common form of dementia that we see. According to a 2022 update, around 6.5 million Americans are diagnosed per year. Well, no, not per year. At this time, it impacts about 1 in 9 individuals over the age of 65. So it is relatively common. This number is expected to double from the 6.5 to about 14 million by 2060. And the primary reason for that is because our population is just getting older. It's just happening. We have longer life expectancies. About 2/3 Americans with Alzheimer's are women. Not entirely sure why. It may be because women live a little longer than men. Not sure. That's just an idea. African Americans are almost twice as likely to have Alzheimer's, and this may be because we see on average that African Americans have an increased risk of developing cardiovascular disease as well as diabetes. And with all of that being said, Alzheimer's at this time is the 7th leading cause of death in the United States. Some early signs and symptoms to be aware of. One is memory loss, challenges in problem solving, difficulty completing familiar tasks, like if you start having a hard time remembering the process of doing dishes or doing laundry, if that becomes difficult, then that's something to be aware of. Confusion with time and place. If you are not sure of the year or who our current president is, those are things that we should have in our memory banks. Having difficulty understanding visual images and spatial relationships. So now with driving, this becomes a little harder to do. Difficulty with speaking or writing, especially if we're having a conversation and then all of a sudden maybe someone kind of stops mid-conversation, is not sure who you are or what's going on, where they're at. That's not something we see on a normal basis. Decreased judgment, and what I mean by this is maybe some difficulties with budgeting or poor hygiene. And then lastly, changes in mood or personality. So what we see on average is that someone with some early signs and symptoms of Alzheimer's may become more irritable, have anxiety about being in the environment with a lot of people, just a couple of different things. So what are the differences between someone who may have signs of Alzheimer's and dementia versus normal cognitive aging? So one, poor judgment and decision making just consistently. Whereas normal cognitive aging is making a bad decision occasionally, maybe forgetting to pay a bill one time, not consistently though. The inability to manage a budget just throughout as compared to missing a monthly payment one time. Those are the differences. Losing track of the date or the season, where compared to forgetting which day it is, remembering it later, right? We all have those times where we kind of can't think of exactly what it is and it comes back to us. Difficulty holding a conversation compared to sometimes forgetting which word to use. I do that all the time. I'm like, wait, what am I trying to say? What's that word I'm looking for? Lastly, misplacing items and being unable to retrace steps. Because we lose items from time to time, right? But we're able to kind of think, oh yeah, I left it there. I did this, I went there, and I usually find what I was missing. But if we can't have no idea, we can't retrace our steps with some cueing, then that's a concern. So why do I bring all this up? Well, what we find is that if you notice these signs in yourself or a loved one, definitely I recommend just talking to a doctor and seeing if they can run some tests because it's hard. We don't want to accept that we're having some difficulties with our memory and cognition, but if this is something that you see and it's a good idea to report to a doctor. Don't ignore them. Okay, so for diagnosis, at this time, there is no single test used to diagnose Alzheimer's disease. There is quite a few steps that they do because diagnosing Alzheimer's disease is a really big deal. So they have to run a couple of tests to really see if that's the true cause for our cognition and issues there, or is it something else going on? So they're going to rule out a lot of other issues like kidney and liver disease before going and jumping into Alzheimer's. So what will happen first is doing a debrief about your medical history, reporting your past and current medical problems or any concerns that you may have. Talking about your medication use, past and present, what does your diet look like, as well as alcohol consumption, and also reporting your family history. If you did have a loved one who had this diagnosis, then I would report that to your doctor. Next, a physical exam, checking your blood pressure, your temperature, all the basic things, as well as looking at your senses, so speech, sensations, some eye movements, how's our strength, how's our tone, coordination, range of motion, just an overall overview of our physical aspects. Next, we'll run some blood work and look at lab tests. And this allows us to look at potentially some causes for the symptoms and help us rule out. So what we'll do is pull blood work, rule out any infections, maybe some vitamin deficiencies, any issues with our liver and kidney function. And then if that looks okay, what's the next step? We can do a urinalysis again to look at kidney function, and then a cerebrospinal fluid analysis, looking at proteins in our fluid that can help us again determining if we have some plaque buildup in our spinal fluid. Okay, so all of that then will be done, and to continue to add up and compile a file of what may lead to Alzheimer's disease, we're going to run some mental health and cognitive tests. So maybe some tests looking at your problem solving, executive functioning, judgment, memory, language. There's a test called the clock test where maybe how do you draw a clock and are you able to place the numbers in the right spaces? That's something that we would test. And then lastly, brain imaging, so doing a CT or an MRI scan to look at the brain itself, as well as a PET scan. So that's going to help us look at blood flow in the brain and also look at potential plaque and tangle buildup. So the stages of Alzheimer's disease, there are about basically 3 of them, early, middle, and late. So with early symptoms, what we might see is forgetting something like a date, for like one date, maybe a recent event or a birthday. Maybe you're having a hard time with managing money. Maybe difficulty doing something that was familiar to you, like doing laundry, something like that. And in the middle stages, now we may need a little help with some basic activities of daily living, so taking care of ourselves, toileting, dressing, doing things around the house. Maybe the behaviors have started to change, some agitation, some restlessness. And in the late stages now, we see significant personality and behavior changes. Now it may be difficult to hold a conversation, and we probably need total dependence with our ability to take care of ourselves. Okay, so how can we treat and manage the disease progression? Currently, there is no cure for Alzheimer's disease. Some treatment options can help to manage the symptoms as well as the disease progression, but there's no set cure for Alzheimer's. One of the medications that is new, it can help to change the disease progression itself. It's called, okay, stick with me, aducanumab. I'm not sure I'm pronouncing that correctly. I'm not familiar with this medication, but it is the first FDA-approved therapy that addresses the actual biology of Alzheimer's disease. So it's going to help and look at the brain and potentially decrease the amount of plaque and tangle buildup that's happening. But it's very limited on actually who's getting this medication. It's inserted via IV. But right now, majority of people who are receiving it, it's through clinical trial. So this is, again, the first medication that's out there. It's not going to restore any of the cognition that's already lost, but it can help to manage the progression so it doesn't get worse, but it's still very new. So hopefully in the future we have some more results from this. So that's one. And we also have a couple of medications that are used to help treat the symptoms. So one is looking at our cognitive symptoms, and this is our cholinesterase inhibitors. They help to prevent the breakdown of acetylcholine, which is a chemical messenger in our brain that helps to relay messages from our brain to our body. And then we have our non-cognitive symptoms, like looking at behavior and psychological effects. These are our orexin receptor antagonist medications. This is also an FDA-approved form of treatment to help treat insomnia, because wandering and restlessness are very common, especially with someone in middle to late stages of Alzheimer's disease. Okay, so something else to be considering. So we talked about medication, now we're talking about behavior, because again, this is definitely a concern with someone who has this diagnosis. So how can we help to manage behavioral symptoms? Thinking about triggering situations and what situations can spike a behavior that we don't want to see and that's difficult to manage. One, moving to a new residence. Are we now moving homes, or maybe we're going to a nursing home? Um, are we having changes in caregiver arrangements? If we had a caregiver, like a loved one, and for some reason they're unable to take care of us for, any longer, having someone new come into that space can be overwhelming. Misperceived threats, admission to a hospital, being asked to bathe or change clothes, those really personal things. And if it's someone that you don't know who it is and you're not familiar with that person, it can be overwhelming. So it's important to just think about what's going on in their environment and is that playing a role in their behavior right now, and how can we help to manage that in the moment and make a more comforting space. So some coping tips to think about: monitoring personal comfort, thinking about someone when they have Alzheimer's, thinking about their pain, if they are in any pain, maybe they're hungry, thirsty, or if they have anything that's irritating their skin, like clothes, just something to be mindful of. Avoid being confrontational. And an example of this is like my grandmother, for example, if she asked, hey, I want to go see my mom, and I wouldn't be like, hey, your mom's already passed away. I wouldn't say that because that can lead to confrontation and a spike in behavior. But if I said, okay, yeah, let's go to the cemetery and let's go see her together, that would be a nice, smooth transition to help manage their behavior, makes them feel comfortable. Redirecting their attention, again, creating a calm environment. And yeah, the last thing, just don't take it personally. That's easier said than done. For sure. But again, this person, when they have Alzheimer's disease, they're experiencing a lot of symptoms that are impacting their cognition. So it's not them. So try not to take whatever they say personally. Again, that's easier said than done. Okay, so with all of that being said, exercise has shown to be really beneficial for someone with Alzheimer's disease, and especially in the early stages of Alzheimer's disease, where we see the most impact. So what can happen is that being physically active can prevent or postpone the aging brain. And what we find is that the recommended 150 minutes of moderate intensity exercise per week is going to not only improve the blood flow to our brain, it's going to potentially increase the volume of our hippocampus. And our hippocampus is what helps us with our memory, so that's going to be beneficial, especially with Alzheimer's disease. For someone who is in the early stages of Alzheimer's disease, exercise can improve processing speed, executive function, and attention. And what we find is that by doing 1 hour of physical activity 2 times a week, by doing aerobic exercise, strengthening, balance, and flexibility, can actually slow the decline in performance of ADLs in your activities of daily living. So by being active 1 hour 2 times a week, that's going to allow you to be more independent in doing things for yourself. So that's huge. We want to make sure we feel independent and we're doing things that are meaningful to us for as long as possible. So with all of that, exercise can also help with restlessness and wandering, especially at night. So if we're engaging in exercise during the day, we're going to feel more tired and sleep better. So that's going to reduce the risk of being restless and wandering around the house. It can help with balance and coordination overall, which is going to prevent and help reduce the risk of falls. Looks at sleep disturbances and then cardiovascular complications. Some things to be mindful of, though: drinking plenty of fluids is definitely big. And when we're in the gym, I would recommend using suspension equipment or resistance bands instead of free weights, because these are less likely to fall and potentially hurt ourselves. And the last one, I definitely recommend supervision with exercise. If you're in the middle to late stages of Alzheimer's, it's big to have someone there with you to make sure you're doing it safely. So again, this information might be helpful to you or might be helpful to someone in your life, but I hope you found this helpful. Here are some references that I used, and as always, if you have any questions whatsoever, I'd be happy to help in any way I can. So I want to thank you all again for attending today's session. If you want to check out our talk about falls and decreasing the risk of falls, that's later on our, you can go back into our YouTube channel and check that out on TriFitness YouTube page. So anyways, thank you all very much. Appreciate it.